Okay, notice that although we're going to hook up to her feet first on this, we put the belt on and we attach it. It's just a fail-safe. Now, I have her do this herself. Now, we're big in as I pointed out, we're big in having the person do the traction themselves or learn how to do it themselves. And we find that the patient will do it better if we will have them do it. So in this instance, she's put this belt on, and notice also that it's very, very loose, because we don't necessarily want to hook up and get the pelvis out of it. So turn right around here, and we get the sacrum. You see, if I were to pull on that, we would have the sacrum involved. Now for this instance, we're going to be just using this as a fail-safe situation in case something happened with her feet here. So we're going to have Jen go ahead and lie down, hook up to the belt, and then we're going to have her put her feet in the deal and go ahead and pull it, and she'll set it to her the way she feels good on her feet. Okay? Notice also that I have set this up in the air. I want to pull at an angle that's going to be pulling and would be pulling against the posterior joints of her back, because they're involved in almost every back problem that a person has. So we want to get the posterior joints traction first, and then we can get traction applied to the disc. So for now, with this the way we set it up, okay? Secondly, we hook up her head, and as you notice, she did it herself again. Okay, she's still doing it. And she now has the neck and head traction on. And so in this particular instance, all I'm going to do is I'm going to have, again, push the top button, and we begin to pull on her neck, okay? So we've got some action there right at the present time, okay? Now I'm going to have her take this, and she can look at it, and she now can lift her back up in the air, okay? Now she's going to lift the back up in the air. Think about this just a moment. What we're doing now is we're trading compression by lifting this up into traction. By the time I've got her at a 30-degree angle, I'll be pulling on her feet at 50% of her body weight. And if we want to put more traction on that, or if she feels like she wants more traction, she now can apply traction here. So go ahead and play okay, a little more traction here, but we are tractioning her, like it says you're supposed to her pain tolerance. Now she is the one that feels this, and I don't feel any pain, or if there was pain. Now let's just say that she had her leg in here and she had something under her foot and it didn't feel good. Okay, what can she do? She can let it back down, okay, and then reposition herself, or let it down to where she can reposition the foot, wiggle the foot, okay, and now she's got, okay, now she's got it set up, and now we go back at it again. So she can go back up, and now go ahead and go back up, okay? So the amount of traction that she's going to apply will be to her pain tolerance. Some days that may be only 10%. Other days it may be 100%. And oftentimes she may feel like she's done exactly the same thing. Okay? So when I've asked patients, how come you did 10% this time and 100% next time? And they're saying, well, I did exactly the same. Well, it really isn't. Go ahead and run that on up higher. Higher? Yeah, it really is. Go as high as we can go. Okay. So this is set to go up to that 30-degree angle we talked about. Anything less than that will only apply less, let's say, than 50% of her body weight turn that into traction. Now, she could, by putting more force here, by making this more, obviously put more force throughout the spine, because everything from her feet to her neck is traction. Okay? Go ahead and go back down now if you would. Let this guy off. And at the same time, we talked about, so we'll turn the traction, the vibration off now, and I'll leave it off, but we would normally leave that on for the duration of the traction. Okay? Now, since we've got her hooked up here, let's just take her feet out of it. Okay, so take both feet out. Set them up any way you want to. And now we're going to traction her, and she's going to be tractioning her low, from the low back all the way to the neck. Okay? Go ahead and run it up again. And that will be at your discretion. So making this to where it's versatile like this makes this to where this is a very, very positive type of action that you're going to do. Now obviously you can see that we're pulling on the pelvic girdle, and we're going to be having traction on every one of the discs from, let's say, the disc from the L5S1 all the way up to in the cervical spine, clear up to the atlas skull relationship. And we can put more force on that if we want to, and we can continue that, and obviously it will be felt throughout the spine. Okay? So again, traction is going to be applied for as long as the patient needs it, up to roughly 15 minutes. Now, here's the thing. At 15 minutes, you're going to have as much, you're going to get as much good out of the traction as you can. When we show the patient how this works, well, we put this traction on them, and we then set it up to where we can actually traction them there, or we could even go and hook a belt up. Dude, just a minute here. Okay, a belt up around the track, let's say her shoulders, and just traction her from the shoulders down to the hips. We're just putting another belt on here that we're going to make it to where the person can hook themselves up to this belt, and now we'll be pulling from the sacrum and up to the shoulder girdle, and that's really where we're going to be on this. So go ahead and lie back down again. We will hook yourself up there again, if you would, patient, assistant patient. And now we're going to, let me run this out. You're going to hook this up to here. Okay, patient, do this to yourself. And she's going to be tractioning, pretty obvious that she's going to be tractioning from the pelvic girdle up, and this would be for the person that's got the main area you want to put traction on, and a lot of traction. You can put a whole lot of traction on this. We can put several times the amount of traction here as we had on the rest of it. And notice all we're doing is pulling from the shoulder girdle to the pelvic girdle, and we can put this up high if you want to, but here is where you're going to run the most of it. At any rate, what we've done is showing you all the ways that you can traction yourself, or the patient can traction themselves, and this type of traction in your office. Okay, let's go back down now, and here's the next part of this. We know that when we put traction, this kind of traction on a person, that we're pulling, and the research shows that we're going to pull about 90% of the fluids that we get into the disc. We're going to pull that in within a very short period of time. However, as soon as they stand up again, put their back under compression, it'll run right back out the same amount unless we increase the fluid's viscosity. So by mixing, having her go back on the wobble chair, and right as soon as she jumps off of traction, and work traction. Now here again, we want to have her use the head weight, because what's the head weight going to do? Reflexly, it's going to force her to hold her head and spine in a normal normal posture. At the same time, what we're doing is having her work her spine through this range of motion, and that range of motion then will increase the viscosity of the new fluids we just pulled in and hooked up with the protoglycan aggregate that was already in there, and it's real viscid, okay? It doesn't want to run out very fast. Now we did, where we did video fluoroscopy on this, and when we was working with doing some prolotherapy, and we found that if we didn't do this, the fluids you take into some of these discs are so pathological that just run right back out again. So we really didn't do very much, okay? In that instance though, here's you've seen the preparation for traction. This kind of traction on the cervical traction, and this is traction also. This is traction and compression. And this is also, as we said, that novel motion that we had to start with that is pumping the cerebrospinal fluid. So when we talk about, we're not talking about just individual situations. What we're talking about is holistic rehabilitation, because that's the way a live person actually works. We treat them like they're alive. Okay? Now we're going to show you some more, but for right now we're going to stop and get Jen on a different table.